So our group will be presenting the Continuum of Care Reform Act by me, Melissa Herrera, Karina Gomez, and Ashley LeBoy. Next slide, please. So who does CCR affect? CCR affects the foster care system. So currently there are 442,000 children placed in the foster care system. Of this, 32% of children are placed in relative care, while 45% of children are placed in non-relative care. There are nearly 4,000 children and youth placed in congregate care, which accounts for 5% of children in care. And of this, 1,000 children placed in group homes have been in care for more than 5 years. Next slide. So children in foster care can be placed in several types of placements, such as foster homes, group homes, non-relative homes, and residential facilities. Children in foster care are at a higher rate of experiencing multiple placement changes along with placement disruption. In addition, during any 12-month period, 50% of children in care experience placement disruption and are moved to a more restrictive placement. Also, children placed in group homes are at a higher rate of being involved in the juvenile justice system and are labeled as difficult, as well as they also have emotional and behavioral issues that require a higher level of care. And over here we have some statistics that youth placed in group homes are 2 times more likely to get involved in the juvenile justice system, and 90% of youth with 5 or more placements will enter the juvenile justice system. Next slide. So what is the Continuum of Care Reform? The Continuum of Care Reform, also known as AB 403, was enacted into legislation on October 11th, 2015 by Governor Edmund Brown. CCR was created with the understanding that children who are unable to live with their biological parents fare better when they are placed in a loving and stable environment. CCR draws together a series of existing and new reforms within the child welfare system to help children attain permanency, and some of the goals of CCR are to provide core services to youth to ensure that the needs of youth are met through stable placements, case planning, and care coordination. And as you can see from our slide, those are the 3 main goals: placement to find stable and loving environments, care planning to have everyone who surrounds the child, including the family, kind of come together and help support them, along with care coordination. Next slide. So what are some of the goals of CCR? So some of the main goals of CCR, and one of the main goals of CCR, is to convert group homes into short-term residential therapeutic treatment programs. STRIPs offer core services to youth, such as mental and behavioral health services. These STRIPs are also meant to be short-term intensive programs, which can last up to 6 months. And the hope of getting rid of the group homes and transitioning them into STRIPs is that youth who reside in STRIPs will be able to get these intensive therapeutic services and eventually be able to transition into stable and loving environments. So the goal is to transition these group homes into STRIPs so that these youth can attain permanency quicker. Next slide. So power, privilege, and oppression. So looking through the transcultural perspective, this dimension emphasizes the dynamic of power relations in the larger society and how those dynamics affect the practitioner-client relationship, in addition to how practitioners approach, analyze, and address problems and contexts. Children in foster care face systematic oppression, especially those in congregate care, because they are left not having a voice in where they get to live and are oftentimes labeled as troublemakers. This is why youth need a higher level of care, because youth tend to be harder to place. So that's where kind of the STRIPs come in place. In addition, children in group homes may also feel powerless within the child welfare system because they do not feel included in their case planning. And this is where CFTs come into place, and Ashley will explain more of what those are later. Also, having a good working relationship with the social worker may be the only way youth feel empowered to speak up and voice their concerns about placement or their case plan. Next slide.
So I'll start by giving a little history of what contributed to CCR. So for over a decade, California has attempted to decrease the amount of children in out-of-home placements. In 1999, an estimated 100,000 children were in out-of-home care. However, in 2014, the estimated number of children in out-of-home care decreased to 60,000. This was a 40,000 decrease of children in care over a 15-year period. Preventative services contributed to that decline in out-of-home care placement. And then additionally, child welfare agencies have worked diligently to establish permanency and decrease the amount of time children spend in foster care. And despite these statistics, it's evident that children are spending longer time in foster care without permanency, and those numbers fluctuate depending on the county and the state. Next slide, please. So there are several implications of CCR. So though the implementation of CCR is new, the historical context behind CCR is that the transition from congregate care to short-term residential therapeutic treatment programs will create long-term stable loving environment for youth. These services will be key for nearly 4,000 youth who reside in group homes across California. CCR also developed a statewide certification process, also known as Resource Family Approval, RFA. Under RFA, current and prospective care providers complete the same approval process and required training. Prior to CCR, were different approval processes and trainings for resource families certified under foster family agencies or county certified homes, and also relative care providers went through a different process. So under CCR, there's one process for everyone across the board. Care providers that were previously approved will be transitioned to a RFA home by 2021. Another implication was the Quality Parenting Initiative, also known as QPI. QPI's core principles are excellent parenting, child development and trauma, community policy and practice, and systems. So QPI requires resource parents to receive adequate training and support with hopes of improving outcomes for reunification and permanency for foster children. Next slide, please. Child and family team meetings were also developed. So CFTs are utilized to bridge the gap between service providers, resource parents, and social workers, biological families. CFTs are strength-based, child-centered, and trauma-informed, and they're used to discuss the child's strengths, needs as it pertains to mental health and behavioral services. Prior to CCR, the reimbursement rate was dependent on age and services. Now, the new protocol is a level of care protocol, and it was implemented to determine foster parent reimbursement rates. So the LOCP considers the following domains, which include physical, behavioral, emotional, health, education, permanency, and family services. Level of care reimbursement rates also taking to consideration if the child is receiving intensive behavioral services to maintain placement in a least restrictive environment. So if the child is experiencing or exhibiting an increase in behaviors and the foster parent is required to do more interventions, then they can complete out a level of care matrix and identify what they're doing with the child in the home to maintain stability. And that is then brought to the CFT meeting and discussed as far as the reimbursement rate. So you can see how each system is interrelated and how it impacts the other to promote stability for foster children. Next slide, please. So number of clients affected by CCR is very difficult to give a number, but it affects everyone involved in the child welfare system. So it affects a child in a way that now the individualized needs are being addressed in each placement options, whether they're with a relative in a resource home or in a strip. Parents or guardians are also affected. They're now included in CFT meetings, case plan development, and their input is very vital when it comes to treatment for their children. Relative caregivers and resource parents were affected because now if they have not already, they will be required to go through the RFA process to be approved and complete those required trainings. Service providers were impacted because their input is relative in case plan development, treatment plans, and discussing placement options if there is a disruption or if the placement needs assistance to maintain stability. And then strips were affected in a sense to now they're only used on the short-term basis, and they're therapeutic placements that are designed to meet the individual needs of the child. So if a child is needed to be there longer than the allotted time, then it has to go through a standard process to um, support or provide evidence as to why this would be their best interest in not being placed in a lower level, at least restrictive placement. Next slide, please. So the cost of CCR, the Chronicles of Social Change in 2018 reports that Governor Jerry Brown allocated $248 million to fund CCR. So beginning in 2018, counties paid 30% of the costs for non-federal temporary assistance for needy families. In 2018, $43.3 million was dispersed throughout California for foster parent recruitment. However, the amount decreased in 2019, where child welfare was only allotted $13.8 million, and then $7.8 million was allotted to probation. Strips were provided $500,000 to redesign their policies and procedures by implementing trauma-informed interventions to decrease calls to law enforcement. Again, this also impacts the child as far as the interventions, and the hope is to decrease the traumatic incidents children experience in these settings. Additional funds were utilized to develop pilot, diversion, and preventative programs throughout California to address the needs of foster children and families. Rather, it was before they came into foster care, in foster care, or as they're exiting. So this impacts our non-minor dependent population as well. Next slide, please. So a few of the benefits of CCR is that foster parents are now required to complete training that as it pertains to trauma-informed practices and intervention, and culturally relevant trainings prior to being approved. CCR implemented one standard approval process, so it eliminates the confusion and questioning of the county as to why certain processes were used or were not used. Strips are used now on a short-term basis, and a step-down plan has to be identified or developed. CFTs are scheduled every 60 to 90 days to address the mental health needs of the child. Again, that brings everybody to the table to discuss what's working well, what can be adjusted, or other interventions. And CCR promotes utilizing a collaborative approach to support the needs of the family. Something that we've always talked about is families being the experts of their family, so bringing them to the table is very important. Next slide, please. So the transcultural perspective, when we're looking at this section, it emphasizes challenging structural inequalities, discrimination, and patterns of exclusion that contribute to problems for individuals and communities. It also focuses on systems rather than symptoms and develops strategies for challenging oppression. So, from a systems perspective, along with the transcultural perspectives, CCR identified and implemented strategies to limit the long term use of strips and the need to identify a transition plan to a least restrictive environment. Um, Prior to CCR, biological families were often excluded from treatment meetings. CCR identified the need for collaborative work in order to improve reunification and permanency outcomes. Um, it's very helpful for parents to utilize approaches that are used in placement when kids are on visits or on family maintenance. And focusing on systems rather than symptoms acknowledges that systems influence outcomes. If we were just focusing on the symptoms or the behaviors that these kids were exhibiting, it would change depending on the child, depending on the population or the culture. So focusing on the system itself and making changes to the system really impacts how children are benefiting from services in foster care and how successful they may be in reunification. Next slide, please. So a few unintended consequences of this policy is that there are limited resource parents that are willing to take placement of older children, non-minor dependents, and children with severe mental health needs and runaways. Lack of resource homes in the county of residence may result in out-of-county placements or strips. Now, resource parents continue to feel that they are not adequately prepared to address the severe behaviors, or once a child is transitioned to a least restrictive placement, if there's a delay in services, it may result in placement disruptions. Next slide, please. Key takeaways of CCR is it encourages positive partnerships with families, focuses on improved outcomes and permanency for children, youth, and families. It promotes a collaboration and shared decision making, meaningful engagement, removes the reliance on group homes for providing long-term care, and children should not have to experience a placement disruption to access mental health or behavioral support services. And CCR also addressed the need for adequate training and support for all caregivers.
So next is the vision of CCR. The main focus of CCR is to obtain permanency for children and youth in foster care. CCR wants to ensure that the services offered under this framework supports both the child, youth, and their families. CCR wants to transition group homes into strips that will offer youth a higher level of care. The vision is that this will allow youth to transition into nurturing, loving, stable homes. CCR is streamlining the approval process for both relatives and non-relatives so that becoming a forever home is one unified process. The RFA processes will allow families to better meet the needs of children in foster care. So now we're going to show you a short interview from the perspective of a foster youth in regards to CCR.
The first time I've been in foster care was when I was 3 years old. And then I exited out of foster care. And then I went back in foster care in about 2013. I've been in group homes. I've been in high-level group homes. I've been in medium-level group homes. Well, for me, it means there's other youth out there who are in my situation or even worse, who need that family connection, that family like bond instead of living in a group home. Because for me, I wish I had that consistency and that one-on-one where they have a consistent bond with another adult or adults instead of having a staff come in each and every hour and having to fight for that attention. I think it's important to have that permanency because as young adults, we're influenced on others, and being in group homes, we're immensely influenced by the people we live with, what we see, what we hear, how we talk, and I feel as if we're in a more stable environment. We grow that sense of maturity, and we kind of mold into what we see, which is stability, which is a family, loving family, accepting. I think that's actually really good because there's some group homes that I've been in that don't have that therapeutic or that therapy there. Basically you're just there because you're there and there's a bed that's available. But since there's a therapeutic aspect to it, when a youth is going through like an emotional stressor or is going through PTSD or is triggered, you can go to the therapeutic side of that program and work with that youth towards figuring out why.
So the pros of CCR and what is working. What's working is access to mental health services, transitional support services for placement, services to achieve permanency to establish a healthy and nurturing environment, trauma-informed care, accountability that more needs to be done for foster care system to help children and youth live in stable, loving homes. Since the implementation of CCRs is fairly new, there are concerns that collaborating agencies that surrounded the child may not be on the same page as the continuing social worker in the terms of placement, services provided to the child, and how to best support the child and the family to retain permanency. Another con would be since STRIP have a 6-month cap, there are concerns surrounding the treatment of children in care and if the time frame is enough time to treat children and youth who display a higher level of care. It is yet to be seen if children in care will obtain permanency due to intensive therapeutic services of STRIP. There is the concern of how CCR will affect youth who do not meet the criteria for STRIP. If only certain youth will qualify, since youth in group homes are already marginalized and hard to place, how will these youth obtain permanency and get the required services needed to reach this goal is a great concern. And more cons, another important concern is availability of RFA homes willing to adopt or provide a permanent home for youth in care. The concern is that there are not enough approved homes for the number of children in the foster care system. Another concern is if CCR will implement mental and behavioral services once children are placed in their permanent homes, and will those services continue for the duration that they are in the foster care system? Recommendations. CCR should be inclusive of all children in care regarding STRIP. STRIP should not only be for those youth who qualify for services, since all children in foster care have experienced some sort of trauma. This is one aspect of CCR that needs to be revised, since all youth should have specialized services offered to them. STRIP should not have a 6-month cap, since youth placed in congregate care tend to be harder to place. A 6-month time frame may not be enough time to rehabilitate youth and to transition them into long-term stable homes. CCR should instead transition these services into home-based services so that youth can continue receiving mental and behavioral health services. CCR has core services that are beneficial to youth and families. However, CCR needs to find a solution that encompasses all youth in congregate care. A number of group homes should remain open for youth who do not qualify for STRIP. In addition, these group homes should offer mental and behavioral health services, and youth should have continued contact with social workers to ensure progress is being made for permanency. So this is our presentation on CCR, and following is our references that we used for our PowerPoint. Thank you.